Thanks very much. It's a pleasure to have a chance to talk to you. And what I'm planning to do for the next few minutes is to talk to you about the strategic clinical networks. And just recently, they've all been named strategic clinical networks. So we don't need to talk about strategic and operational clinical networks any longer. And the perspective that I'm going to be taking is to talk about the alignment or lack thereof between choosing wisely and the mandate of the SCNs. And for those of you who may not be aware, the strategic clinical networks built on some work that was done in previous networks, but there are 9 of them currently. They're between 5 and 17 months old, and they are a network of clinicians, researchers, academics, patients, community organizations, and government focused on a particular condition, population, or healthcare delivery site. We have 9 of them, as I mentioned: addiction and mental health and emergency department, cardiovascular and stroke, cancer, critical care, diabetes, obesity and nutrition, seniors, bone and joint, and surgery, and a respiratory one about to launch in the new year. So I'm going to talk a little bit about how these are aligned. How can the choosing wisely 5 things that you've heard about inform us? And a little bit about how they're different. You've heard a lot about choosing wisely, so I won't go into a great deal of detail. But basically, it is about helping patients and physicians engage in conversations about the overuse of tests and procedures, with an aim to improve quality and safety of healthcare in America, and to help physicians to be better stewards of healthcare resources. Very well aligned with the IHI triple aim, as you've heard. The SCNs are a group of physicians and clinician leaders developing and implementing evidence-informed, clinician-led health improvement to achieve the highest quality care with the best outcomes at the lowest reasonable cost. So you can see that this also aligns with triple aim and the goals of that. The focus here is a little bit different in that it expands to talk about physicians who are incredibly important in this whole equation, but also embraces the notion that other clinicians have a role to play. And recently, in some work that we did on stat toxicology testing in emergency department, that's exactly what we found. Physicians, of course, write those orders, but what we found was the behavior of the nurses, and in fact, how the IT system is set up, and whether a tick box pops up in the order set or not has a great deal to do with what winds up being ordered. There's an emphasis in both of these initiatives that you'll see on patient engagement, in discussion. In the SCNs so far, most of that emphasis has been around including patients in our networks, trying to understand the patient journey, and some really important work that's happened around patients actually doing engagement research. In choosing wisely, the focus has been much more on enabling discussions between physicians and patients, and also to improve outcomes and the health of the population, although you could argue one person at a time. There's a shared emphasis on costs. The Choosing Wisely campaign explicitly wants to lower costs, and SCNs, I can tell you, have been encouraged very strongly to look at reassessment projects, at ways that we can find to reduce costs and eliminate wastes. One of the theories behind the reassessment within the SCNs is that then some of that saving can be reinvested in quality care to improve outcomes. And when we looked at the recommendations that have come out of the 50-some specialties in the states and compared those recommendations to the work that the SCNs are currently doing, we saw a large number of examples of alignment. Some of those recommendations have to do with reducing the inappropriate use of drugs, and several of the SCNs have also been starting to look at that. There's a project being led by the Seniors Health SCN, that the Addiction and Mental Health SCN is a partner, to look at the use of inappropriate antipsychotics in long-term care, for example. The Respiratory Network has looked at the use of corticosteroids in children under 2 for respiratory problems. There's been a lot of discussion this afternoon already about reducing costs and risks of unwarranted radiation. And that is something as well that several of the networks have been looking at. Certainly cancer, cardiovascular disease and stroke, emergency departments, seniors, have all at least some focus on the use of imaging. And there has been discussion of a future network actually coming into play that might focus on that area specifically. Also, reducing unnecessary diagnostic tests, and we do have some examples across the networks, like the stat toxicology and emergency department that we've been looking at that. One of the things that is a bit different, and I'll get into it in a couple of minutes, is that a lot of the work that the networks are doing is around clinical pathway development. So while the emphasis of choosing wisely to date that I've seen is on tests and procedures, a lot of the emphasis on the network has been on understanding the patient's journey and trying to connect the pieces, which includes tests and interventions, across the continuum of care. So a lot of the focus of the networks has been on that journey, and you'll see elements of the kinds of things that you would see in choosing wisely. Some of the other recommendations are in our planning stage, or what we often refer to as the pipeline. So there are recommendations around reducing urinary catheterizations in the elderly and the use of blood transfusions, the use of pre-surgical, or the increasing the use of pre-surgical treatments for head and neck cancer, standardizing antibiotics and corticosteroids in COPD. And then others, when we looked at the recommendations from Choosing Wisely, are just in our thinking stage. That notion of when is it appropriate to do imaging for patients with dementia, cardiac imaging. There's a lot of work that that network is wanting to do around looking at appropriate use. The use of CT for cancer screening in healthy individuals has been raised. But the initiatives are not the same, and there are some differences. Briefly, when we look at the recommendations, there are some Canadian and some Albertan differences in clinical practice, which isn't too surprising. So I think some of those recommendations that we see may not be as appropriate for us, and others we may need to substitute. The example that's being given, some of the examples have been that it may not be such a big problem in Alberta, the insertion of feeding tubes in the seniors, as it is in the States right now. Survivorship planning in cancer care may not be the same priority. We may be doing it pretty well right now. Or pre-op surgical guidelines may be more consistent in Canada. As I mentioned, the networks focus on the continuum of care, not on a specific procedure or intervention. And so what you will see in some of the work of the networks is more upstream or health promotion, disease prevention, early identification work. So you'll see things like school-based mental health promotion. How could we do that? How can we measure it? We'll see things like the Vascular Risk Reduction Project, which is being led by the Cardiovascular and Stroke Network with partnership with cancer and addiction and mental health to look at how do we improve the primary prevention for some of those diseases. We also have been looking at not only what not to do, but what to do. And sometimes that can be just as important to health outcomes. So for example, in addiction and mental health, we know that there's huge variation in how often any of our patients are advised to engage in physical activity, even though we've got loads and loads of evidence that it's going to improve their outcomes, and perhaps start to make a dent in the 15-year age gap with which people with severe and persistent mental illness die. We're going to be looking at things like limiting the fasting that happens around surgical procedures, because that will also increase the healthy outcomes, which diabetes, obesity, and nutrition are looking at. One of the things that's already been mentioned is the partnership that they have in the States with Consumers Reports, and I think that that's really important. And it's starting, as far as I can tell, to move that Choosing Wisely campaign from a primarily specialist-driven initiative to one that really also has a strong consumer-driven component. If you have the chance to go on the website of Consumer Reports, there's a button for patients to push, and there's lots of anecdotal evidence of patients having taken information to their provider and initiated that discussion about what would be the most appropriate care. And finally, the choosing wisely is laying some foundation for some sensitive discussions. And this I'll give you the example of the one from internal medicine, which is don't recommend cancer screening in adults with life expectancies of less than 10 years. I talked to the people in our cancer network, and they said, no, we don't use that kind of a guideline. There used to be some around age. We've largely backed away from that. But if you think of some of the slides you've seen this afternoon about the burden of cost in healthcare in the last year of life, if we don't start to have some of those conversations and in fact encourage those between providers and patients, we might be missing a tremendously important opportunity. One of the mandates of the SCNs is to measure and to report and to also be able to articulate how a change has impacted value for money. And I think that's a bit of a difference as well. The bottom line is that the Choosing Wisely guidelines, I think, are tremendously helpful to us. They are well researched. They have validated some of the priorities that the networks have already selected or are considering. They've already provoked discussion about other areas that we should be looking at as we mature. And they stimulate clinical engagement and discussion, and they encourage patient and provider discussions. And those can only have positive outcomes. Thank you.